Hey guys, welcome back to my channel, and today I'm showing you what I'm packing in my hospital bag for VSG surgery tomorrow. I'm super excited, and let's just jump straight into it. So I am packing a tiny bit of makeup. This is just some moisturizer. I don't think I'm going to end up using some of this, and I certainly don't need makeup, obviously, after surgery. I'm honestly just bringing this in case I am feeling good, and I just want to give myself something to do while, maybe I'm waiting to be discharged, or, depending on how long I'm there for. Surgeon thinks I'm only going to be there overnight, and then into the next day I should be getting ready to be discharged. But again, I'm just bringing this so I have something to honestly just occupy my time if I'm feeling up to it. May not even use it. I am going to bring some perfume. Again, this is something that I may not even use. I hear a lot of people say not to bring this just because you should be really mindful of other patients and nurses and the staff there, and if they have any allergies or sensitivities to like the smells. So I might not end up using it, but I'm going to bring it just to be safe. I'll probably just ask them if it's okay to put it on, and just put a few sprays on if they say it's okay, just so I can be courteous of everybody else. But I am going to pack it just to be safe. I also am bringing some deodorant. This is just one of those little travel size like spray-ons. I've had this in the house for a while, so I am going to bring that. I just think it's going to be so much easier than dealing with the stick. Plus, I don't want to bring all of my household essentials and then have to like unpack everything the next day. So I'm trying to stick to some stuff that I can either just toss once I'm at the hospital, or things that I won't need to take out right away once I get home. And then going off of that, I'm bringing a toothpaste and and a toothbrush as well. So I get these every time I go to the dentist for my cleanings. I honestly just keep them stocked up in the house. I do have an electric toothbrush, which I love, but it is sometimes a pain when you have to deal with the traveling case and disassembling it all. And then like the charger if it dies on you. So I am just going to bring this. I think it's going to be so much easier, so I can just dispose of it after I'm done using it. And then the toothpaste, there's only a tiny bit left in here, so I can get rid of that once it's done anyways. So I'm trying to kind of think on that line, of what can I just dispose of once I'm done with it and not have to deal with once I bring it back home. I do have some medicine right here. It's for my nausea, and then this one's the Oxycodone. These I may not honestly even end up needing, but I am going to bring them. Obviously the Oxycodone is for pain. I don't know what's going to happen after surgery once I am off of the IV medication. And I'd rather just have that to be safe, so that way I'm as comfortable as possible on the way home. And same thing with the nausea. I don't know how I'm going to be feeling. I don't even know what they're going to give me at the hospital as far as like once I'm off of the IV. So I just want to have that to be safe. I did not bring it down yet, but I do have my Levothyroxine and my anxiety medication as well, which I'm going to be packing. I have a little pill container for them that I'm just going to throw in, and I'm going to bring that for Thursday. So my surgery is tomorrow on Wednesday. I can take the medicine. They already told me I can take those 2 medicines before surgery, and that's totally fine. But as far as on Thursday, I don't know how I'm going to be feeling, but I am going to bring the medicine to be on the safe side. It's not a huge deal if I don't get to take it. It's just a day, but I am going to pack it just to be on the safe side. And I also just have like a hair tie and just like a scrunchie just in case I want to put my hair up. And now I'm going to kind of move into, I also have a hairbrush as well. And as far as like electronics, I'm just bringing this extra long extension cord. I honestly found this, I think I got this at a gas station. I could be wrong, but I'm pretty sure I did. But you can obviously find those on Amazon and Walmart, places like that. So I do highly recommend those, just because you don't know where the plug's going to be in your room, and I want to make sure I have plenty, that way I can charge my phone. I don't even know if I'm going to be using it that much, but again, it's just those things that I'd rather have. And I think this is a 10-footer, I believe. I cannot currently find my earbuds, which I'm so sad about. I'm still trying to find them before tomorrow, but I do have a backup pair here that I'm going to bring just to be on the safe side. The good thing about these is this is all stuff that Anthony can also use, like if I happen to be, sleeping and he's there visiting me, because there is restrictions due to COVID. But if he is there visiting me while, they allow him, I do want to make sure that he has stuff as well that he can use. So this is actually a book. It's 1984. Highly recommended if you have not read it yet. But we're both actually reading this. So I did bring this just because I figured, again, not even sure if I'm going to be up to reading. Probably not, but it also gives him something to do while he's, if he doesn't want to be watching TV or something or using his phone. So that will be good for both of us just in case. And then just kind of quickly moving into all of my kind of clothes and stuff like that. So I bought these on clearance. These are just some basically like little slipper socks. They do have the little grips on the bottom though, and I got them on clearance for like $1 and change at JCPenney when it was the end of the season, and I knew my surgery was coming up, so I did buy these because a lot of times people do say to not bring your own personal slippers just because of the amount of germs and things like that in the hospital. I am by no means like someone who is like, the person that is always thinking about germs and things like that. That's not me. But it was a good point on the video that I did watch. And I was like, I am going to just bring something that I can honestly just dispose of. These are super cute, so it's kind of a shame. But honestly, I might even be able to wash these when I get home as well. So we'll see. They may not let me walk in them if they say they're not safe, which is fine. These will still be really good to keep my feet warm and things like that after surgery while I'm in bed. So I have that, just some socks, and I'm not going to go through, obviously, like, any personal undergarments, like underwear and stuff, but I would just recommend just bring something comfortable, wear your least attractive items because you're not even going to care in that moment, I guarantee, and comfortability is that even a word? Comfortability? Being comfortable is the most important thing. So, anywho, I have this little nightgown, like long, oversized t-shirt, essentially, that I got from Walmart a while back. I love this thing. I wear it, like, all the time. And I just think it's, like, the cutest thing with, like, the little eyelashes. But I don't know how comfortable those little, garments are going to be that they're going to give me. I'm going to ask them if I can put this on once I'm a little bit more alert, like after surgery. I don't know what they'll say, but I would rather ask at least because I think just being in my own clothes will make me a little bit more comfortable. And I am bringing a few different things. I'm not going to go over every single one, but I have just like some really comfy, stretchy leggings. These ones are off of Amazon. I love them so much. So I'm going to bring those. And I also have some sweatpants as well that I don't think are laid out right now, but I have them. They're from American Eagle. Again, super soft and stretchy, but the band is a bit like it does kind of cinch to your waist. So I am bringing these leggings just to be on the safe side in case those pants are not comfortable. And then this is just a light little like workout jacket. I'm bringing this just in case it's cold out. I do think the weather's going to be a little chilly when we're leaving the hospital, or when I tentatively should be leaving, I should say. So Thursday morning isn't going to be all day on Thursday. It's not supposed to be like super warm out, so I am bringing this to be safe. I did also bring a long sleeve t-shirt as well as a short sleeve. I'm just going to, again, kind of base it off of the weather and how it is, and that will kind of determine what I'm wearing. I'm probably just going to wear these to the hospital tomorrow because there's honestly no point. I know as soon as I get there, they're just going to tell me to take it off, so I'm not going to try to look cute or anything like that. I'm just going to be comfortable, and whatever I plan on wearing, I'm just going to do this. This is my little duffel bag that I'm going to be packing it all into. I do think I might end up packing a small blanket from home. I am always freezing, and although yes, the hospital can provide those, I personally just want my own blanket. It will make me feel so much more at home. I hate hospitals. They give me anxiety. The doctors are amazing. I could never do what they do, but hospitals give me so much anxiety after like this past year, and that's like a whole entire other story, but I just want to feel as comfortable as possible. So I am going to be packing a light blanket. I just don't have it out yet because it's actually being washed right now. And then I'm doing that because then I can also put that in the wash as soon as I get home, and it'll be clean. And it's definitely something that I can just not have to worry about or having something to dispose of. So I am going to be doing that. I don't think I'm going to end up bringing a pillow because I don't think that's necessary, but I at least want my own blanket because, again, I'm always freezing, and I think it'll just help make me feel a little bit more at home. So this is everything. I'm going to pack all of that stuff right there into that bag and put this all away now. There's not really anything else. Oh, and then I also have a chapstick as well, but I think it's in my bag because I was kind of throwing some stuff in there. Yeah. So I also have just a little bit of chapstick as well. And obviously, if you need any like feminine products, anything like that, do that as well. I'm just trying not to go overboard. I see so many different things. I'm going to link a video if I can find it. It was actually a video on what not to pack for VSG, and it was coming from a nurse, and I am so grateful I found that video because she made some excellent points talking about like gas X and how the air is being pumped into you. Like, it's not true gas, if that makes sense. So having some gas X really isn't going to help a ton. The only thing that will really help is walking, and I almost bought gas X, so I'm glad I didn't. I am gonna wait for anything like to deal with, like, as far as like constipation medicines, things like that. I am holding off on that because I would rather just see where I'm at, and worst case, if I have to, I can obviously get something else, but I am gonna hold off for now. And my doctor said that was fine, to just kind of play it by ear, and obviously don't take it unless I actually need it. So that's everything. I hope you guys enjoyed this video, and let me know what you guys end up packing in your hospital bags, or if there's anything that you packed and maybe didn't end up using that you thought you were going to use, things like that. Just, let me know. I'd be interested to see. I have watched a ton of other hospital bag videos as well, so I feel like I kind of have a good arrangement here on things that I can have, because I have a book if I want to read. I have my phone, obviously. I don't know if there will be a TV there, but I have plenty of options if I want to like watch videos. So we're definitely good to go, and I will catch you guys in my next video. And yeah, let me know what else you guys want to hear about my new chapter in life, and just keep watching because I will be posting a surgery day video as well. Once that obviously happens, I'm going to try to film as much as possible in the hospital, depending on what they allow me to do and how in or out of it I am. So I will catch you guys soon. Thanks. Bye.